Up, we've got Chiara who's CEO of Careticker, who's here to present her mobile app, which is called Careticker, which is kind of a patient empowerment tool for pre-op, post-op. It also allows providers to monitor their patients. So take it away.
Thank you. Wow, we've got a packed house here today. Holy moly, how's everyone doing? So thank you. So I'm Chiara Bell. I'm the CEO and founder of Careticker. Are these working? Slides? Basically what Careticker is it your mobile co-pilot in recovery. When we first were starting to look at the market, what we found was that everyone's talking about readmissions today, right? And what we realized is the road to recovery is very bumpy. Pre-planning before the hospital admission is minimal at best. Hospitals failed to provide really kind of clear and concise discharge instructions. You get a set of discharge instructions, such as stock of photocopied papers, and a lot of times it ends up in the backseat of the car on the way home from the hospital and you never read it. There's a very difficult way to coordinate your needs post-discharge. And at the end of the day, for family members and for the patients, the road to recovery is very scary and confusing. And we thought a lot about this as we looked at the market, and we said, you know, the big gaps that happen in our transition from the hospital to home aren't very large things. They're usually checklist items such as making that follow-up doctor's appointment, items such as making sure you have the proper equipment and goods and supplies when you get home, and making sure you have a caregiver to help you when you get home to assist you in your recovery. And so when we looked at it, we said, why wouldn't we take the checklist manifesto and bring it to your mobile phone, put it in your back pocket based on your procedures? And so that's what we've built with Careticker, is a platform where we have a suite of applications that's very procedure-based, based on your needs before you go into the hospital. The more we started talking with discharge planners and patients, the more we found that what is the one healthcare event that everyone plans for? Anyone? Outside of this huge group? Having a baby, right? So we thought, why wouldn't we start our first application this isn't working, by the way, guys. Oh, there we go. I'm gonna flip through these slides, sorry. All right, that's not working, so we're gonna put this down. There we go. So why don't we plan for all of our healthcare events the same way we do with the birthed child? So what we did was we created a application on the Careticker platform called Knocked Up. And so the vision with Knocked Up is that we should plan for any sort of admission into the hospital the same way we plan for having a baby. Thank you. So here, can everybody see that now? So what I've set up here is the application. You can see I've registered. And one of the things that we also identified in our research is a lot of these healthcare applications out there ask the user or the patient to do a lot. And so what we've created is you can actually, all of your checklists are pre-customized based on your procedure. So you'll see here I've registered, I'm in my second trimester, and it automatically shows me what my to-dos are, as well as tips that I need to do. So think of this as you think of other procedures in the very same way. Imagine if I'm going in to have hip surgery, I'm also going to have the same type of customized checklist. So you'll see here I can pre-register. I have to pre-register at the hospital, and I have general checklists based on each event that I'm going in for. So before the hospital, during the hospital, and then items that I need to do at home. So let's take a look first at, for example, second trimester. So here's my checklist of items that I need to do. And as I check them off, I can actually measure and follow whether or not the patient's being compliant. So right now we're in a pilot with a large physician group in South Florida, and basically we're pushing back information to them with respect to, is the patient doing a certain number of the pre-admission items that we're asking them to do. So as we go through, we can see that that'll change the percentages of whether or not the patient's completing their items. The other issue is reminders. And so prompting and nudging the patient to do things before they get admitted to the hospital is very important. But one of the things that we notice with patients is they don't like to go in and create their own reminders. So what we've done is we've preset and created all of the reminders, again, based on the procedure for the patient, right through the application. So all they need to do is download the application and the reminders are already created for them. The second important thing is I'm going into the hospital, but I need to find a specialist. And here where the data comes in. The other thing that the application has done is that we've aggregated all the data with respect to providers specific to procedures. So if I'm going in to have a baby, for example, I can find, let's say I'm looking for a doula. Right from the application, it'll pull in the doula and search the specialist, and you can connect with those doulas immediately from the application. How about if I need to find OBGYN? I can, again, pull that in. The real power in this data that we've aggregated is we've also pulled in the provider specific data, what networks that provider is participating in. So you can see here Newton Osborne is participating in Aetna, Aetna HMO, and First Health PPO. We've aggregated the data across all the largest providers, Aetna, Cigna, United, whether or not all the participating providers in their networks. So now let's say I'm going to be going into the hospital and I want to communicate with my physician and my family and friends and let them know, and they can follow and track, am I doing the things that I'm supposed to be doing before I'm admitted to the hospital? So you see here, I'm going to add Matthew Holt because he's in the audience. I'm going to pull him up. And so now Matthew's been added. So now what will happen is Matthew will get a text message saying that he's been added to my network. And now he's just going to get push notifications of confirming that I've completed certain tasks and encouraging me as I complete those tasks. So now let's say I've done all of the pre-planning work that I need to do, and now I'm going in to have my surgery. So we've also pulled in all of the hospital-specific data. So very easily, as a patient, I'm going in to have my surgery. Let's say I'm going to Georgetown University. I'm going to check into that hospital, and the physician, my friends, my support group, such as Matthew Holt, who is participating in my network, will get a text message saying that I've checked into the hospital. So now as that I'm in the hospital, the other thing is that I'm still using so here's the checklist, the confirmation that I've checked into Georgetown University Hospital. So now that I have entered the hospital, there's still items that I need to do. So again, what our checklist does is it engages you with respect to the things that you need to do in the hospital and then finally at home. So what happens when I'm going home? So I'm going home and now I'm going to be checking out. So again, what we've developed is you're going to simply just check out of the hospital, and your physician, your family, your friends, and everyone's going to get notification and text message, oh, Chiara's going home from the hospital. Now the power in this, when we talk about the provider networks that we have, is that we trigger and ping the ancillary providers with respect to the fact that I am heading home. So they can confirm whether or not the medical equipment has been delivered, they can confirm whether or not the follow-up appointment has been made, and so it's building this communication infrastructure, but it's very consumer-based. Finally, now that I'm home, let's make sure that I'm on the right road to recovery. So what do I need to do to get my breastfeeding consultation? 50% of discharges from the hospital don't make their follow-up doctor visit. We believe that that's not necessarily a technology problem. We believe that that's just a patient engagement problem. And so exactly what we built in here is that I'm discharged from the hospital, I have my procedure-specific application, I have the reminders being pushed to me, but I also have my physician and my care team getting notifications to whether or not I've actually checked that item off my checklist once I'm home. And so when we talk about, I'll put this down for a second. When we talk about readmissions to the hospitals, one of the things that the mission is with Careticker is we saw a lot of products built specifically for the hospital systems and for the large providers, but there wasn't anything built specifically for the consumers. And it's great that we have initiatives coming down that are penalizing hospitals now for readmissions, and physicians are starting to get penalized. But we also believe that the consumer has an accountability role in this. And why not build a suite of products and applications so that they're fully engaged in their procedures before, during, and after their recovery at home, and also connecting them with the providers that they need. Now, very quickly, I'm just going to talk a little bit about the data set that we have. So basically what our data platform consists of is aggregates it from multiple platforms and multiple sources. We use the data.gov open information, NPI registry data. We partnered with a large company with respect to pulling all of the information of providers from specific payer directories. So we've got well over 3 million pieces of data with respect to provider information. And we believe that as we build this out, we're building data that's very specific to procedures. So imagine we have Careticker and we have every person in the state of Florida who's just checked in today who's going in to have knee surgery. Think about the power and the data that we can do on multiple fronts with respect to coordination of goods and services, as well as real-time assistance of assisting people in their recovery at home. We believe that this will take a very big chunk and start chipping away at the readmission problem that's costing us about $25 billion a year. So with that, I'm going to open it up to some questions to the ton of people in the audience. Anybody have any questions? Yes, sir? Is this your...
What's the text message from?
Oh, all my... You turned your phone off. Yeah, your battery is low. Thanks, though. Yes, sir? That is a fabulous question. So basically, we're partnering with physicians. So we're piloting right now with one of the largest physician groups in South Florida. And we're saying, just hand out a prescription to our application and give it to your patient, and then they download the application and they start using it. We're working with the physicians in a second front with respect to developing the protocols for the checklist based on procedure. So they're helping us really identify and iterate on these unique checklists that we're creating for every procedure for the admission to the hospital.
So what did you mean when you said you have all patients kind of
Right, so what we're seeing actually, which is another great question, is we're seeing a great trend with in our pilot of people who are utilizing the application, and they're going into so we have someone in Palm Beach County, Florida, and someone in Vero Beach, and then someone in Miami, who are all being admitted on the same day to have a baby. And so as we're applying that out from that real-time data check-in information, we're applying that to the other procedures. So now imagine every person who's going in to have knee surgery in those different counties. So from a coordination of goods and services, as well as support of their recovery, and are they doing things right, or are they not doing things right, so that they stay healthy and don't end up back in the hospital.
I may have missed this in the beginning. I think it looks great. Are physicians entering any of the data into this app, or is it all patient-driven in terms of their checklist and in terms of what's in there?
That's a great question. It's all patient-entered. So think of it as a fully self-management care tool for the patient. The only thing that we're starting to test with the physicians is we're pushing back to them information with respect to whether or not the patients have completed the items on the checklist. And so they're using that as, they're being bombarded with a lot of information now, but what they like is they're just getting a general report on what patients are completing what items on the checklist.
So since the patients are choosing to enroll in this and choosing to put the information on there, have you been able to avoid any worries of privacy of that patient's health information? Because they're basically checking in at a hospital or checking, in terms of that?
Not yet. I mean, obviously privacy is always kind of on our top forefront of concern with respect to what's being submitted from patients. But we haven't, actually the one thing that we had, it was funny when I was testing it out with my family and my mom, what the patients loved about it is that, right away they called, oh my God, you've been admitted to the hospital. what happened. So we haven't had any big concerns yet on that, but of course we are always, you know.
Is it
focused on-
HIPAA compliant, or are you not even addressing that?
Well, we're not, don't look at it as applicable.
Okay.
But because again, it's just a full self management tool submitted by the patients.
Thank you.
Oh my God, there's a sea of people. Anyone else? Any other questions? Well, I appreciate everyone's time, the very few who are here, for coming to see the presentation. And we're in booth 56 if you guys have any questions before the cocktail party. Come on down and see us. Thank you very much.
Thank you, Chiara.